I'd like to welcome you to today's webinar. And for those of you who are joining us from the Northeast United States, I just wanted to wish that you are warm and safe right now. We're thinking about you. I'm going to be facilitating today's webinar along with Star Tiffany and Joanna Hathaway at Dialogue for Health. And I just wanted to give a shout out to Star for all the help that she's provided over the last several weeks in pulling this webinar together. Before we officially start our webinar, let me take a few minutes to tell you about some technical details. If you experience technical difficulties during this WebEx session, please dial 1-866-229-3239 for assistance. Or if you have trouble dialing in or hearing the webinar, please post a message in the Q&A box and Star will assist you. Home Team Captions and Regina specifically will be providing real-time closed captioning for today's webinar. You can see the caption text in the Media Viewer panel, which can be accessed by clicking on the icon that looks like a small circle with a film strip running through it. On a PC, this icon can be found at the top right-hand corner of your screen, and on a Mac, it should be located at the bottom right-hand corner of your screen. If you want to take a minute to notice at the bottom of that media viewer, there is a Show Hide Header link. If you click on that, it will remove the header and give you a little bit more room to read the captioning. Remember, if during the webinar another window causes the media viewer panel to collapse, you can always reopen the window by clicking on the icon that looks like a small circle with a film strip running through it. While our panelists are presenting, we're going to have everyone's phone and computer on mute. Then when we get to the end of the presentations, I'm going to show you how you can ask a verbal question by raising your hand. If you have any questions, though, during the presentations, which we hope you will, please feel free to add them to the Q&A box on the right side of the screen so that we can address those and any other questions at the end. When you add a question, please submit questions to all panelists, but we would ask you if you have a particular question for one presenter, please indicate that in your question. Once the webinar ends today, a survey evaluation which was developed by the Region 4 Training Center is going to open in a new window. Please take a moment to complete this anonymous evaluation because we really want your feedback on this. Also, the recording and the slides will be emailed out to you and everyone in the PHTC network after the webinar. I'm going to ask Joanna now to do me a favor. Joanna, would you mind opening the polling question, please? Thank you. Before we begin, we'd like to ask you to answer one polling question, which is on the right side of the screen right now. Select your answer from the available choices and click the Submit button. I am attending this webinar, and the response choices are A, individually, B, in a group of 2 to 5 people, C, in a group of 6 to 10 people, or D, in a group of more than 10 people. Select your response and click Submit. And remember, once you've done answering the poll question, click on the Media Viewer icon to bring back closed captioning if it has collapsed. At this point, it is my pleasure to turn the program over to Miriam Gerdine. Miriam is the Project Officer at HRSA and is overseeing the grants management of Regions 1 through 5 of the Regional Public Health Training Centers. Miriam, please go ahead.
Thank you, Laura. Welcome, everyone, to today's webinar, Public Health Training Centers Network Collective Role in Helping the Public Health Workforce Prepare for and Respond to Infectious Diseases, hosted by Region 4 of the Public Health Training Centers. In September of 2014, HRSA provided $7.9 million of federal funds to 10 regional public health training centers for the 2014-2015 budget year. The purpose of the Regional Public Health Training Centers program is to improve the nation's public health system by strengthening the technical, scientific, managerial, and leadership competencies of the public health workforce. In collaboration with HRSA, the Regional Public Health Training Centers program together are comprising a national program that will serve all 50 states, the District of Columbia, the Virgin Islands, Puerto Rico, and the 6 U.S. Pacific jurisdictions. Region 4 of the Public Health Training Center would like for me to also extend a special thanks to all of the partners who've assisted in the development of this webinar, including the National Coordinating Center for Public Health Training, Region 1 of the Public Health Training Centers, my agency, HRSA, the Health Resource Services Administration, the Centers for Disease Control and Prevention, the National Association of County and City Health Officials, the Association of State and Territorial Health Officials, and Dialogue for Health. At this point, I would like to introduce Vinny LaFonda. Vinny serves as NNPHI's President and CEO and is honored to serve as the Principal Investigator for the newly formed National Coordinating Center for Public Health Training. He has worked in both public and private sectors in public health and human services programs. His 30-year career continues to focus on health-related program and policy development and implementation efforts to benefit the public's health and well-being. Vinny will tell you a little bit more about the purpose of the webinar and provide you with an update on the Ebola-related training data that the National Coordinating Center has collected from the public health training centers. Please go ahead, Vinny.
Miriam, thank you so much, and good afternoon, everyone. And Laura, thank you for your exemplary leadership on this webinar. As I reflect on our work in the newly forming network of training centers, I am reminded of the words of Andrew Carnegie. Teamwork is the ability to work together toward a common vision, the ability to direct individual accomplishments toward organizational objectives, and it is the fuel that allows common people to obtain uncommon results. And I think this network is all about that type of teamwork, and we're seeing